Questions, comments? Mark?
Thanks, Vicki. I think that really sheds a lot of light. And that I just want to point out that one of the things that makes your task difficult is that we are trying to understand and define certain types of mental illness that we don't fully understand. This is an evolving arena, and we do our best to get definitions that are useful before we sometimes have the scientific basis for them. And I want to bring attention. Have you heard that there's an outbreak of paralytic diseases in California? And have you heard that it's polio? It's polio going around? It's not. But it used to be that all paralytic diseases of young people were considered to be polio. And so if there was an infant with flaccid paralysis, we assumed that was polio and used that as the definition. The problem was we didn't understand the biological, and we couldn't identify the virus in those cases. So we didn't really understand the biological scientific basis to differentiate between flaccid paralysis that was polio, flaccid paralysis that was caused by enteroviruses, like this outbreak in California. But as we developed better tools, we could get better definitions. We didn't have to rely on flaccid paralysis as the definition of the problem, but we could talk about polio. We could talk about enteroviral illness like this one in California. And the real importance of that is we could better treat and prevent that problem. And the same thing here. Tom Insull is leading an effort at NIMH to help better define the biological basis for a lot of these diseases, but we don't have it all laid out yet. So in the meantime, we have a variety of different types of definitions, different types of criteria that we're using to help us improve how we identify and treat these. And that's part of what makes this so complicated and what makes your task, Vicki, so hard. But we're doing this in the middle of an evolving basis of understanding the problem of these diseases and understanding the biological basis of violence. It's a shifting field, and the definitions are our best attempt now, but we realize they may change.
And realize that there's a range of stakeholders involved in the process of labeling these things. Insurance companies, professionals, the American Psychiatric Association, the International Classification of Diseases. So there's a whole range of power brokers who want to claim areas of disability for them. And so they all work with each other to kind of affect how these definitions get formed. And as social attitudes change over time, so too will those forces.
And we go in front of judges, and we go in front of physicians, we go in front of psychologists. So many people play.
Insurance companies have a lot of power in some of these definitions.
Also, we're doing it at a time at which the healthcare environment is changing. So it's like not only are we worried about the definition, we're worrying also about where, when, and who in the system is going to be the intervener, and whether or not they have sufficient tools, resources to do what it is that we think will probably be the most effective intervention.
And the idea that science drives it all, well, science is just one of the many actors. There's many other actors who are trying to define these conditions. And so science, we like to think that science kind of leads the cart, but in fact, it's often a follower. And it has an input, but should it be the only input? That's another question. I don't think it necessarily should be, but it needs to have its voice heard and interact with the range of actors who make these definitions.
I'd even raise, should science be the driver? I think I'm good. All right.
I have one quick comment, if you don't mind. I really appreciate the definitions that you've brought us, and then but I also, in light of the science, want to caution us that when all the learnings around brain science and where the impact is, whether it's prenatal or epigenetic or in the family, the learnings from the adverse childhood experiences, and where the child or the youngster is affected by the environment that they're in, and then how that leads to the changes. I think we have to kind of keep that in mind, because what our interventions and our prevention will look like need to take into account the brain science that's rapidly developing about the impact of trauma and so forth. So I appreciate that we have some definitions that can help lead us through the day, and I just want to bring that up as well.
I think it's an excellent point. Thank you.
Thanks, Vickie.